Hi, my name is Benjamin Bakal. I'm the clinical director at Associated Retina Consultants in Phoenix in Arizona. I'm also a clinical assistant professor at the University of Arizona in Phoenix. And I presented data on the 3-year follow-up using MCO010, an optogenetics treatment for retinitis pigmentosa. Yeah, so in patients with advanced retinal dystrophies, including retinitis pigmentosa, we know that the photoreceptors are gone, they lost them, and people have severe vision loss. But oftentimes the inner retina is remaining, especially the bipolar cells, and those are targeted with this multi-characteristic opsin using an AAV vector with a single intravitreal injection for more durable improvement in the vision long term. Yeah, so we've seen for the RESTORE study, that was the 1 year, the primary endpoint, we could see that there was a clinical and statistically significant improvement in the visual acuity using the Freiburg visual acuity chart of 3 lines in both the doses that were used compared to sham. And in the 3-year data in the RETAIN study, we could see that we see durability of this 3-line gain of vision in both the treatment doses, which is really exciting. Yeah, so in these 27 patients in this study, there were 15 different gene mutations, and several were undetermined mutations. And we really didn't see that the mutations had a specific effect on the outcome and the improvement in the vision. So this is truly a gene-agnostic treatment for advanced retinal dystrophies and retinitis pigmentosa. Yeah, so we looked at specifically 2 different outcomes. The patients that improved 6 lines or better in the visual acuity, and also patients that had improvement in 2 of the 3 outcomes, the visual acuity and the low luminance mobility testing and low luminance shape discrimination testing. And the 2 main outcomes we could see what the patient had less thinning of the retina and better vision at baseline did better on these outcomes. Yeah, so regarding safety, so we know that anytime we do intravitreal injections, we're always worried about safety, and inflammation is a key part of that. But fortunately in this study, we only saw mild or moderate levels of inflammation that could be treated, and we did not see, that's really important, we did not see any evidence of occlusive vasculitis, of hypopyon or hypotony or retinitis. And fitting this into the broader landscape, we think that this is a relatively safe treatment and seems to be durable at 3 years. Patients that have advanced retinal dystrophy and retinitis pigmentosa, we don't want to overpromise, so we want to be realistic with this treatment. So really what's exciting with this treatment, that the patient-reported outcomes, some of these patients in the study have reported that they're able to ambulate better, see things in their surrounding better. They're sitting down at the table, they can see the utensils and the plate and see what they're eating much better. Some patients also reported that when there are passengers in a car, they can now see other cars moving around. So these patient-reported outcomes, I think, are really key to show that there's true clinical benefit with this treatment long term. Well, talking about this area of treatment, optogenetics, specifically multi-characteristic opsins. So the first step is hopefully having approval for this treatment for retinitis pigmentosa, but in the pipeline maybe also the same treatment for Stargardt disease, and maybe in the future also advanced age-related macular degeneration. And I'm also very hopeful about other treatments. Comparing to 10 years ago, we only had 1 active trial for inherited eye diseases. Now I think there are over 60 different trials for different retinal dystrophies. So that is really exciting. We may have more treatments coming out soon. Yeah, so regarding AI, I think that's really exciting. I think it's really kind of a growing field. I think the first areas that we're gonna have a true benefit is selecting patients for clinical studies and reducing the adverse effects. I think also, like in the day-to-day clinical practice, maybe using AI agents to interview patients, new patients, regarding their medical history, and that will save a lot of technician time entering that data into the chart. But I think that since it's an evolving area, we're going to find more and more uses, as time goes by.